Hello relatives, welcome to this week's Schlagbite for the week May 7th, 2012, entitled Psychedelic Therapy. Let me first say the green screen behind me is no longer there. I give you a chance to look at my office with the steps leading up to my library and hope that the visual quality is as good. The New York Times just featured an article in its Sunday magazine section a couple of weeks ago on the effectiveness of a psychedelic drug in quelling the fear and anxiety in patients facing death. It talked about psilocybin, the psychoactive agent in magic mushrooms, and how it helped 12 anxious, fearful, depressed people find peace and allowed them to enjoy the rest of the time they had left. This is not new information. Thousands of papers have been published about the beneficial effects of psychedelic drug therapy. They've involved tens of thousands of patients who have suffered everything from addictions to stress disorders, chronic depression, in addition to end-of-life anxiety. I have been a strong supporter of the use of these drugs at the end of life ever since I prescribed ketamine for a patient of mine who was dying with a metastatic cancer. And you can read about this in my book, Kindling Spirit, and there's a link here on the bite this week. But in brief, this was an angry, anxious 62-year-old man with liver cancer that had spread. And his experience with ketamine was very much the same as described in the New York Times magazine article. My patient came into a consciousness that allowed him to appreciate the remainder of his days. The real question, it seems to me, is whether or not one has to be dying in order to find such peace. I will tell you that I've worked with Native Americans for most of my professional life, and I can tell you that the most effective treatment program for Native alcoholism has been participation in the Native American Church, which uses peyote as its holy sacrament. There are now studies being conducted on the use of psychedelics in the treatment of post-traumatic stress disorders, depressions, acute anxiety states. Under professional and ceremonial supervision, I can actually see psychedelic-assisted therapy as an adjunct in couples therapy with teenagers with identity crises. The problem, of course, is the potential for its abuse, and I'd like to talk with you about that in our next webinar. At the very least, I think that it is necessary that we make these drugs more available, at least in palliative care settings. They should be a standard part of all the choices available to patients in hospice care. At the end of our lives, psychedelic therapy can provide a light at the end of the tunnel. Join me for the next Schlagbite webinar next Thursday, the 17th of May. Take a look at the website on the Schlagbite. You'll see the link to register, and write questions to me beforehand if you're embarrassed to put your name on it during the webinar at webmaster@healingdoc.com. Have a wonderful week. Remember, we are all related. Have a great week. Nobody makes it alone. Stay connected. I say this for all my relations. Mitakuye.